You know that when we get into any type of injury, traumatic, in this case, it can take some time for things to really settle down a little bit. So, for me to kind of come up with a conclusion other than, basic stuff, I can definitely do that. But in terms of coming up with some basic stuff, I think that's pretty. Hey, you have low back pain.
Mm-hmm.
Do I think you have a disc-related issue into your neck or your low back? I think it's kind of too early to tell, but I can tell you when you slam on the brakes or when you get hit, when you have that massive amount of trauma, you're going to end up having a lot of irritation to the nerves, which is the numbness and tingling that's happening into your arm.
Yeah.
That's why I asked which division is it. It's just the whole hand. You're like, okay, I can't really tell. I did some what we call neural tension sign tests, which is to see if I can pull down on the nerves going through the whole cord going this direction. And I did certain divisions of it. That this one was fine, this one hurt, this one was hurting. So it does, and that's why you may feel some of that pain that goes up through these cords, through here, through the median or the ulnar, kind of more towards this side or towards this side, but not as much like this direction.
Right.
You definitely have some sort of form of whiplash. I'm not going to question that whatsoever, but it's also associated with what we call cervical radiculitis, which is a fancy word for saying neck irritation and that nerve irritation. You know a little bit about chiropractic, so we'll talk a little bit about that.
Yeah.
In terms of your low back, obviously at this point in time, you're not having any numbness or tingling. You're having some SI and lower back discomfort and dysfunction. When I was kind of doing some hip extension tests and some other stuff, I'm not entirely done with the testing, but this is pretty straightforward in the lower back. You just have a lot of lower back probably, and you just have a lot of tension going on.
Yeah.
This thing will calm down. You're just not having a true sciatica based injury. It makes sense why you can't bend over or touch your toes at this point in time.
Yeah.
That prone hip extension test that I just did, hey, lift your leg up. You're like, that requires a lot of that. You were really tender when I poked on through here. You were also really tender when I poked on through that left side here.
Yeah.
Even though you're still having right-sided, so you could still have right-sided nerve pain and left-sided neck pain. It may shift side to side. I don't know yet.
Okay.
I'm just here to help you feel better, and as I put my hands on you, and as we kind of work through this, and as the inflammation goes down, you'll definitely feel a lot better.
Okay.
But you just been through a lot. I don't think you're actually having an elbow issue.
Okay.
I think the elbow had some
residual
pain,
yeah.
And then as a result of the neck whiplash, you're having nerve-related pain.
Yeah.
Because the elbow strengthening test was like me doing all these funky things, and it just didn't affect the elbow. It's just when I moved the neck and the arm and the hand and did all this funky stuff is when you actually had more of the symptoms. So I don't think it's true elbow pain. I think it's a true neck issue.
Okay.
But we did evaluate it, and so we can at least say that we tried to see if it would be an elbow issue.
Okay.
It doesn't mean I won't work through the elbow and through the course of that nerve, but it just means that's what we're dealing with at this point.
Okay.
I know it's fairly basic to some extent, but it's also kind of complex because we don't necessarily know what we're going to be encountering in the bridge come 2 days ago when the inflammation hopefully comes down.
Right.
That's when things will the water will get clearer, and we'll see a little bit clearer about what's going on.
Okay.
Do you have any questions for me?
Not as of currently, no.
Cool.